what about the impact of this pandemic on immigrant communities? That is one community that we really haven't touched on very much. So, would anyone like to chime in on this one?
I did hear, uh, we talk about uh, disparity, the effect of this on people of color. Latinx um, are dying at a higher rate than African Americans, and it depends what you call, you know, what people of Latino heritage are dying, and many of them are obviously are immigrants.
Sure. Yeah.
And a lot of this, and we didn't mention it, is I don't think we did, is that so many of the people who have gone back to work, are uh,
Mm-hmm.
essential workers. uh, They are exposed.
Yeah. Yeah.
They're exposed to COVID. So if you're and they get paid almost nothing. So you're talking about you go to the supermarket, the people working in the supermarket on our behalf, they're getting sick.
Mm-hmm.
And, uh, that's part of the statistics of that is that people who absolutely financially have to go back to work expose themselves to the risk.
Yes, and then also everybody gets sick. So I mean, really, not I care on a humanitarian basis, but if you just wanted to be very, cut and dried about it, it's terrible for the whole country.
Well,
Print,
again, that's what we go back to what Mary said we really should be doing. And that's look, this guy, Trump, for 2 months, he denied that this was a problem.
I know. Yeah. Prentice and Mary, could you talk about a little bit about from a medical standpoint what we can do to help immigrant communities with?
Well, uh, I mean, a lot of it is the Latinx population, and I've been looking at the data, and the rates are going up, the mortality rates are going up, and we're we're seeing the precarity of what it means to be an immigrant, and particularly if you're an undocumented immigrant, the jobs you have to take, the housing you have to live in, and the how you get to work are all settings in which you're exposed. And additionally, though, we know that the rates of uninsurance are highest in the Latinx population, probably related to the fact that when you're undocumented, you have hardly any entitlement to anything but emergency care. And that is, been extraordinarily short-sighted for all the reasons that we've been talking about for the past hour. And in Boston, the hot spots outside of the nursing homes, which have been a key hotspot, have been the Latinx communities. Chelsea, very hard hit. This is a working class Latino community. And it has all to do with not having, I'm just repeating myself, but in addition, not having access to medical care, not having access to testing. People are afraid to go. You're told you won't be charged if you have COVID. Well, what does that mean? What happens if it turns out that you have, something else? Are you going to pay for that? As long as it's unclear, as it is for most of us when we go to the doctor, what it's going to cost us when we are finished with that visit. People who don't have money are not going to go until it's really late, and then the risk of dying is higher. So on that cheerful note.
I know, Prentice, any final thoughts on that question?
Just that, it all comes back to we can't have a laissez-faire system of healthcare. And we also can't have leadership that wants to blame the victims. So hopefully we'll have a change in all of that.